Part A. Extract 1. Questions 1 to 12. You hear a gynecologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes. Good morning, Mrs. Mihiraa. Please come in and have a seat.
Good morning, Dr. Sharma. Thank you for seeing me so soon.
Of course, Mrs. Mihiraa. Now, you mentioned something urgent on the phone. Can you tell me what brings you in today?
I got scared as I am in the 32nd week of pregnancy, and I've been experiencing some worrying symptoms lately. That's why I booked the appointment urgently.
I understand. Can you tell me more about these symptoms?
Well, it all started about a week ago. I've been experiencing these terrible headaches that won't seem to go away. They're throbbing, and sometimes I even feel like I'm losing my vision for a few seconds.
I see. Have you noticed any other symptoms?
Yes, actually, my hands and feet have been swollen quite a bit, especially in the mornings. And yesterday, I had this strange episode where I felt really confused and dizzy, like I was about to faint.
I see. Those are certainly concerning symptoms, Mrs. Mihiraa. These symptoms could be indicative of several conditions, and some of them could potentially indicate serious complications during pregnancy. To get a clearer picture, I'll need to ask you some more questions.
Okay, please do.
Firstly, do you have any pre-existing medical conditions?
No, I've always been healthy.
Have you had your blood pressure checked recently?
No, not in a while. But my mom has high blood pressure, so I should probably get that done, right?
Absolutely. Now, I need to ask you a few more questions about your medical history. Have you ever experienced any seizures before?
No, never.
And are you taking any medications currently?
Just prenatal vitamins.
I see. Have you noticed any other changes, like increased urination or abdominal pain?
Now that you mention it, yes, I've been needing to go to the toilet more often. Occasionally, my abdomen experiences a sensation of tightness and discomfort.
And do you have any known allergies to any medications?
No, I'm not allergic to anything.
Thank you. Mrs. Mihiraa, your symptoms, coupled with your pregnancy, raise some concerns. I suspect you might have eclampsia, a severe form with potentially life-threatening complications for both you and the baby.
Oh my God, that's terrible. What do we do now?
Don't worry, Mrs. Mihiraa. We'll need to run some tests to confirm the diagnosis. I'll order blood tests to check your blood pressure, protein levels, and platelet count. We might also need a urine test and an ultrasound to assess the baby's well-being.
Okay, I'm willing to do whatever it takes.
That's good to hear. Depending on the test results, we'll discuss the best course of treatment. In the meantime, it's crucial to rest and avoid strenuous activity.
Thank you so much, Dr. Lee. I feel much better knowing we have a plan.
We'll get through this together, Mrs. Mihiraa. I'll see you again as soon as we have the test results. In the meantime, don't hesitate to call me if you experience any worsening symptoms.
Thank you again, Dr. Lee. I'll do that.
Extract 2. Questions 13 to 24. You hear a diabetic nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. How are you doing today?
Good morning, Nurse Feather. I've been feeling a bit overwhelmed lately, but I'm managing. I'm here for my follow-up visit.
I understand. It can be a lot to take in. Let's go over how you've been feeling. Can you describe any specific symptoms or changes in your health since your last visit?
Well, I've been experiencing some fatigue and occasional dizziness. My vision gets blurry at times, and I've noticed that my wounds take longer to heal.
Thank you for sharing that with me, Mihiraa. These symptoms are common with diabetes, but it's good you're monitoring them. Let's review your test results now. Based on your recent blood work, it appears you have type 2 diabetes.
I had a feeling that might be the case. What does that mean for me?
Type 2 diabetes means that your body doesn't handle insulin effectively, which leads to elevated blood sugar levels. We'll need to start managing this with medication and lifestyle changes. For medication, your doctor has prescribed glucophage. It helps to control blood sugar levels by improving how your body uses insulin.
Okay. Will it have any side effects?
Some people experience digestive upset like diarrhea or nausea. It usually goes away after a few days. It's important to take the medication regularly as prescribed.
Okay, and what about my diet? Do I need to make any specific changes?
Yes, diet plays a crucial role in managing diabetes. You'll need to follow a low-sugar, low-carbohydrate diet. Focus on eating whole grains, lean proteins, vegetables, and fruits with a low glycemic index. It's also important to avoid sugary drinks and processed foods.
That sounds manageable. What other lifestyle changes do I need to consider?
Regular physical activity is very important. Aim for at least 30 minutes of moderate exercise, such as walking or cycling, most days of the week. Additionally, maintaining a healthy weight is crucial, so we'll work on a plan that includes both diet and exercise to help you reach and maintain your target weight. The aim should be to bring your HbA1c level below 7% over the next few months.
I see. Is there a specific blood sugar level I should aim to maintain?
Yes, you should aim to keep your blood sugar levels between 80 and 130 mg per deciliter before meals and less than 180 mg per deciliter 2 hours after starting a meal. Consistently monitoring your blood sugar levels will be key in managing your condition.
I see. Is there a specific blood sugar level I should aim to maintain?
Yes, you should aim to keep your blood sugar levels between 80 and 130 mg per deciliter before meals and less than 180 mg per deciliter 2 hours after starting a meal. Consistently monitoring your blood sugar levels will be key in managing your condition.
That sounds reasonable. Is it possible to reverse type 2 diabetes?
For some individuals, it's possible to achieve remission, meaning normal blood sugar levels without the need for medication. This often requires significant and sustained lifestyle changes, including weight loss and regular physical activity. However, it's important to understand that diabetes management is a lifelong commitment. Even if you achieve it, ongoing monitoring and healthy habits are essential to prevent a recurrence.
Thank you, Nurse Feather. I feel more informed now and ready to take the necessary steps.
That is the end of Part A.